Hello, my name is Dr. Shiva Kumar. Have you ever wondered what happens when the body's internal traffic system goes haywire? Today we dive into the intriguing world of a medical condition known as blind loop syndrome, also referred to as bacterial overgrowth syndrome or stagnant bowel syndrome. Imagine a busy highway. Now imagine a section of this highway that's blocked off, causing a traffic jam. This is similar to what happens in the small intestine with blind loop syndrome. Normally, the small intestine is responsible for the absorption of nutrients from the food we eat. It's a one-way traffic system with a steady flow thanks to a process called peristalsis, which is essentially the coordinated contraction and relaxation of intestinal muscles to move food along. But in blind loop syndrome, this flow is interrupted. It's like a roadblock in the intestine, which can be due to various reasons such as diverticula, small pouches that can form in the digestive system, fistula, an abnormal connection between two body parts, or strictures, an abnormal narrowing of a body passage, often related to a condition called Crohn's disease. There can also be functional stasis, as seen in a condition called scleroderma, where the body's immune system mistakenly attacks the tissue in the skin and organs. Now, what happens when there's a blockage? Well, traffic backs up, and in the case of the small intestine, food and bacteria accumulate, leading to an overgrowth of colon-type bacteria such as E. coli and bacteroids. Depending on where this traffic jam occurs, different symptoms can manifest. High loops or blockages in the upper part of the small intestine can lead to a condition called steatorrhea, which is the excessive excretion of fat in feces due to fat malabsorption. Low loops or blockages in the lower part of the small intestine can result in anemia due to vitamin B12 deficiency. This deficiency arises because the overgrown bacteria bind to the vitamin B12, preventing its absorption. So how do doctors diagnose this condition? Through a series of tests, of course. A decrease in serum cobalamin, another term for vitamin B12, along with increased folate levels in the blood, can suggest blind loop syndrome. An abnormal Schilling test, which measures vitamin B12 absorption, can also indicate this condition. Interestingly, this test typically normalizes after about 5 days of taking an antibiotic called tetracycline. Another diagnostic tool is the 14-CD xylose breath test, which checks for bacterial overgrowth in the small intestine. And what about treatment? The most common approach involves the use of broad-spectrum antibiotics to reduce the bacterial overgrowth. In some cases, surgical intervention may be necessary to remove the traffic jam in the intestine. In conclusion, blind loop syndrome is a fascinating medical condition that's like a traffic jam in the intestine, leading to a range of symptoms from diarrhea and fat malabsorption to anemia. It's diagnosed through a combination of blood and breath tests and treated with antibiotics or sometimes surgery. So the next time you're stuck in traffic, spare a thought for the complex traffic system working away inside your body.